Sorry, I was muted. How y'all doing?
All right. How are you? How are y'all?
Good today. How's everybody? Marilyn, how are you?
I'm doing good. That music always gets me bouncing.
You always jam out to the music. I
I
made
got.
that just for Dr. Mac. You know that, right?
I
And I
appreciate
appreciate. I appreciate it too, Dr. Mac. Thank you, Dr. Mac. See.
it.
He likes jazzy tunes. When Reynolds Jazz Lounge was on the beach, every now and again we'd run into Dr. Mac and his family dining there and enjoying the live jazz. So I figured I'd find something a little jazzy for Dr. Mac.
Well, I
Very
appreciate it.
good.
I
Yeah.
appreciate it. I
All right. It's
appreciate
good
it.
to
Wait,
see y'all today.
it's
Yeah.
good to see you. Wait, hold up, hold up, Dr. Mac. I think we got the same colors going on
We
here
do.
today.
I
Y'all
did.
We
got.
I didn't get the memo. I did not get the memo.
last week April and I were coordinated, and now Marilyn,
Hmm.
you and I
I
coordinated.
know. I was jealous. I just admit. I confess. I was jealous.
That's what happened.
She must have called Michael Lamont to see what I was wearing today.
That's obviously what happened. I tell you.
I'm
I
telling
saw
you, that's exactly what happened.
That's exactly what happened. Yeah, I saw that he had a nice little live auction going on the other day.
Oh yeah.
Mac, you didn't spend too much, did you?
No, I just got picked up a little something, not too
Okay.
much.
Okay.
Oh, okay. All right. Just checking. Well, of course, we're back this week with more COVID-19 updates, and it's 4th of July weekend, y'all. It's
Woo.
hot. There's a lot going on. It's going to be interesting to see what happens this weekend with all of the COVID activity still happening, and yet we still have a lot of socializing and festivals and all kinds of things going on. So I hope that everyone is tuned in to find out what's happening this week, the numbers and everything that Dr. Mac has to share with all of you. So Dr. Matt, we're going to kick it off in just a moment, but I just want to remind everyone that we also have two very special uh, guests joining us today. Denise Chatman with Optimism Preventive Services and Dennzon Winley, who is a mentor and volunteer with that organization. And they are going to share with us more information about their virtual tour around the world. It's a conference, a 2-day conference, teams around the world beyond Georgetown. It's pretty fascinating. Want to learn more about it. Yeah,
Very good. My home folks.
exactly. Your hometown
Yeah.
people.
Hmm.
Yeah. So we're gonna go ahead and have Dr. Mac jump into the COVID-19 updates. And Dr. Mac, I'm gonna let you start wherever it is you want to begin.
Okay. Thank you, and it's good to be here again. Um, it's been an interesting week, a lot of happenings, a lot of things going on, specifically in the numbers, as we usually start off with. In the world, uh, total number of cases have gone in the last week. This data is a weekly data. From last week, it's gone from 9.8 million cases to 11.1 million cases.
Mm.
The number of deaths worldwide have gone from 459,000 to 526,000. Specifically in United States, the number of cases have gone from 2.5 million to right under 2.9 million cases. The number of deaths have gone from 127,000 to 132,000 deaths. South Carolina, the number of cases have gone from 29,000 to a little over 41,000 cases. South Carolina, 29,000 cases to a little over 41,000 cases. And the number of deaths in South Carolina over the last week has gone from 691 deaths to right at 790 deaths. In Horry County, the number of cases have gone from 2,500 to right under 4,000. And the number of deaths in the last week in South Carolina has gone from 42 to 50. Georgetown County, the number of cases have gone from 337 cases to 549 with 4 deaths. And in Marion County, the number of cases have gone from 170 cases to 234, and the number of deaths have gone from 6 to 8 in the last week. Now, In analyzing these numbers and looking at some of the information that's been going over the last week, the U.S. makes up about 4% of the world's population, but accounts for approximately 25% of the world's deaths due to COVID-19. In the past 48 hours, this past Wednesday and yesterday, we've had record high numbers, consecutive days of positive cases. Wednesday in the United States, there was over 51,000 positive cases, new cases. And yesterday, there was over 52,000 newly diagnosed cases in the United States. Now, those are both consecutive day highs. This past week marked the 6-month anniversary of the outbreak of cases and documented cases of known cases of COVID-19. In the last 6 months, we reached a milestone of 10 million cases and 500,000 deaths in 6 months. And again, those numbers are likely they're likely under, because again, there are a lot of cases that we felt were related to COVID-19, but the person was not tested because they had passed away. Over the last week, the CDC has added 3 new symptoms to the symptoms that are associated with COVID-19. The CDC has added runny nose, or what we call rhinorrhea, nausea, and diarrhea as 2 new possible coronavirus symptoms to watch out for. Now, we already know about the fever, the chills, the shortness of breath, fatigue, muscle aches, body aches, loss of taste and smell with headaches. But these are 3 new symptoms that have since been added as possible symptoms to watch for. Remember, the symptoms can be mild to severe, with most symptoms happening 2 to 14 days after exposure. But remember, there are a number of people that will be asymptomatic, that will not have any symptoms whatsoever. Other news is that 16 states have rolled back or paused reopening. Cases are rising in 31 plus states, and greater than 60% of the states have some type of mask order in place. Now, the next thing that I want to kind of really focus on is really our area and Horry County, Georgetown County, and South Carolina. In South Carolina, looking zip code wise, specifically talking about Carolina Forest, there are 534 zip codes in South Carolina. 534. Out of those 534, the Carolina Forest zip code has the 4th highest number of COVID positive cases. Carolina Forest. The Socastee zip code of 29588 is 7th in the state. The Conway zip code 29526 is 9th in the state. And the Myrtle Beach zip code of 29577 is 14th in the state. What's happening is that we're starting to isolate these places based off of zip codes and starting to see that there are definite hot spots that are popping up throughout the state. There's an interesting map that I saw from my friend Jamie Arnold, the chief meteorologist at WMBF News. And basically what he's done is he's taken the areas, hot spots, looked at zip codes, looked at counties, and made it look as if it were consistent with a hurricane, with categories 1 through 5. And as we see, Horry County, Charleston County, Berkeley County, Richland County, Sumter County, Chesterfield County, up in Greenville, those areas would be considered category 5. So they would be considered catastrophic. Category 4s would be Florence County, Georgetown County, and some other counties that we see here. So when I saw this, and I did talk to him and got permission to use this, it was interesting how this was put into play, really based off of DHEC numbers to look at what areas are really having issues, what areas are considered hot spots in the state. Now, looking at the biggest thing that's happening now is a number of these young people are actually being positive testing, particularly the teens and the young adults. On that slide that we just showed 900 and there's been a 966% increase in newly reported cases in young people 11 to 20 years old. 966% increase. In those 23 to 30 years old, a 414% increase in newly reported cases. And this is information from DHEC. So as we see, the number of cases are being driven by those between 11 to 30. There's more testing that's being done, and a lot of these people are testing positive. And the belief is that it's because a lot of these folks are not wearing face masks in this age bracket. Now, specifically looking at hospitals, during the month of June, there was a 466% increase in hospitalizations in Horry County compared to May. So from May to June, the number of hospitalizations went up 466%. Grand Strand is now at 100% capacity with close to 50 patients there with COVID that are COVID positive and almost 40 that are suspected with COVID positive. April, if you could put that slide up one more time for me. As you see, this is broken down by counties, and this data is actually a week old. So these numbers are actually higher now than they were when this graph was reproduced a week ago. But I just want to show this to look at some of the numbers and some of the counties and how they are impacted as far as the bed occupancy. But Horry County is higher than that now. Spartanburg County is higher. Lexington County is higher. Richland County is higher. And again, that is very worrisome and concerning. Now, looking at the next slide, even though, right, we go to the banner. So even looking at this, even though South Carolina is testing more, we're still far behind the number of tests that need to be done. South Carolina is running about 739 tests per 10,000 residents, which puts us only at 37th in actual number of tests that are being done in comparison to the rest of the states and the District of Columbia, despite having the 21st highest rate of cases. So even though we're doing more testing, and that's great, that's wonderful, we still are behind the tests that are being done. So that's still something that we still need to work on, and still something that's a work in progress.
Dr. Mack, of course, it goes without saying that these numbers are particularly alarming, and it's even more intriguing, if for lack of a better word, that we still have as much activity as we have, and this weekend is going to be bananas as far as the amount of visitors coming into the area. I passed a fireworks store maybe a couple of hours ago. It was jam-packed to the point of cars being out in the road, people getting ready for the 4th of July celebration. Lots of cars on the road. I don't know if you guys have been out in traffic, but North Carolina, New York, Pennsylvania, I've seen tags from everywhere. People are coming into the area, and it's knowing that, especially with that near 1,000% increase in COVID cases in the young people, or at least that age group 11 to 30, we know that we're probably going to see a lot of that particular population, or those groups are going to be on the beach this weekend. And so, I guess the conclusion is that the numbers are only going to be much higher, much worse after this particular weekend. In the next 2 or 3 weeks, we'll probably see more cases. And, from the standpoint of just preparation, I think we touch upon this every time we do an update. What are physicians saying right now? How does everyone feel in the medical world about what you all are about to encounter?
It's worrisome because there was a thought initially from, I don't want to say non-believers, but people that were kind of minimizing this, that, oh, there's just an increased number of cases because we're testing more. Well, no, that's not true. There's an increased number of cases because because there are more people that are being infected. There are more people that are passing it. And the mere fact of that is showing that the increased number of hospitalizations. So, in fact, the number of deaths have started kind of going down percentage-wise, but that's because we're having younger people that are testing positive.
Mm-hmm.
However, with all these people in the hospital now, there will be an increase. Unfortunately, there will likely be an increase in the number of deaths. What's happening is these young people are getting it. They're taking it to loved ones who are sicker, who are older, who have a more compromised immune system, and they're making these people sick. And that's really the truth of the matter. The concern is that there's still this lack of forcefulness that some of the quote unquote leaders are not. They're not really handling business. I mean, I had a call to one of our county councilmen, and about a 40-minute conversation about them still having this Horry County Fair. Mm-hmm. I expressed my concern. I expressed my worry that Carolina Forest, as I said, is the fourth highest number. And that racetrack is in Carolina Forest.
That's right.
And so the concern is, the response that I got back was that, well, they're working with DHEC and that they're going to, have people wear a mask and they're going to ensure this, but they're not going to clean those rides after every person gets off the ride.
No,
yeah, that's not realistic, and it's not going to happen. And so the concern is you've got a county fair for 10 days, not just 1 or 2 days, for 10 days in a hot spot, the fourth highest number of COVID cases in the Carolina Forest zip code out of the 530 plus zip codes in South Carolina. Mm-hmm. That's worrisome. It's concerning, and it's irresponsible to have that happen. And that's just the bottom line.
And you can throw social distancing out the door at any festival. It's unrealistic to even believe that people will follow social distancing rules or policies. They won't do it in Walmart, much less at a festival with, several thousand people attending at one time. And I think I read that, one of the concessions, pun intended, that the Horry County State Fair said that they would consider, or that they might implement, is to offer fewer vendors. And that does not matter. It just does.
That just means more people are going to be piling up at those vendors. They're not going to spread out.
Exactly.
So that would actually be the wrong thing to do. That's the wrong thing to do. It should be more if they're going to do it.
To try at least spread the crowd out a little bit.
Right.
Yeah.
Mm-hmm. What we do know is that a number of municipalities have some type of mask ordinance in play. Myrtle Beach has one that's supposedly up, will run until Labor Day. Fines up to $100.
$100, that's right.
North Myrtle Beach, there's a 60 days fine of $25. Georgetown County and Georgetown City, 60 days, $25 and $50 fine respectively. Florence County, $25 fine. They're going to meet again July 13th, where it'll either be changed or revoked their policy. Lake City, no fine, but 60 days for the policy. And Conway will vote on theirs this coming week. But all of these areas have outs. All these areas have exemptions where people can go without wearing the mask. Mm-hmm. And so the concern is that although some things have been put in place, I just don't think that it was enough.
And it's not only the ordinance, but informing the population that the ordinance is in place. And I received a phone call today, someone upset because they were in Dollar General in rural Georgetown and people were without masks. But there wasn't any posting from the county, like in the store door, that says this ordinance kicked in at midnight tonight. It's now mandatory or whatever, requested. So not only are they responsible to pass the ordinance, they need to go above and beyond just enough to inform citizens. You can't assume everybody's watching the news.
Exactly.
You know,
Exactly.
everybody doesn't read the newspaper. You got to post it all over social media. They need to go to every store in Georgetown, and they can do it. That's why you have the sheriff cars and the police, and just say, "Here's the flyer. Stick it on your door." There's no excuse once you do everything that you're supposed to do. But we're finding that's not happening, you know, at the speed that it should be taking place.
Right. I had an interesting conversation with someone this week who was asking me about the number of, basically saying, well, looks like we may be doing a little bit better because the deaths are dropping down. And I had to explain to them just what I said earlier, that story is still to be written because of all these number of people in the hospital. So statistically, more people are probably going to die, unfortunately. But what I had to explain to them was physicians are not only looking at this in terms of death, we're looking in terms of this of worsening conditions. For example, I've had now over 25 patients with COVID-19, okay? About half of those people had either asthma or emphysema or some form of lung condition. Those folks, half of those went into the hospital without oxygen. And half of those came out with oxygen. And the oxygen will likely be lifelong. So it's not just in terms of death, it's also in terms of extension of chronic conditions that have worsened, that will worsen. We know for a fact that, people that develop what we call ARDS, adult respiratory distress syndrome, where those people end up on ventilators, those people have a greater risk of long-term health issues. We know that when people are in an intensive care unit, mental issues such as post-traumatic stress disorder and anxiety and depression will increase. We know that people who have lung function issues that have lung function decrease will likely negatively affect organs like the heart, the kidneys, the brain, and other significant impacts overall that will likely lower people's life expectancy. So this is something that is going to be a problem. I've got some patients that have moved down here from New York City who were part of 9/11. And they still go up to New York to get evaluations as a part of the 9/11 Commission. And a lot of those people have significant lung issues from having lung problems from inhaling asbestos and other type of chemicals. Well, a lot of people feel like this may be something similar to that with the way that COVID affects the lungs. So there's a real concern about this, not just in numbers of death and dying, but in numbers of worsening chronic conditions. Okay.
Yeah, and so Marilyn, I just got your message, and take care. Hope everything is okay. We'll check on you a little bit later, but thank you for joining us for the first few moments. We really do appreciate you.
No problem. I'll see you guys next week, and have a good holiday weekend. Thanks.
Okay. All right. No problem.
Yeah. And the other thing, April, is just looking at, how schools are going to be impacted.
Oh, yeah.
I think, was it Columbus County that just said that they were going to a shortened school week? I think it's 3 days in class and 2 days at home, or vice versa.
Yeah.
Where my daughter goes to school, Hampton University has just announced that there will be fall will be all online.
Yeah. Yeah.
My alma mater, Morehouse, was the first a scholarship football program that is say that they're not going to have football this year. As a matter of fact, they're canceling all sports. So, in the world of college athletics, this is something that's big now. The NCAA is looking at this, schools are looking at this, conferences are looking at this, and we're not sure what's going to happen with college football this year. I mean, some people are saying not playing. Some people are saying moving football to the spring. Some people are saying just go with it, and then if the numbers get out of hand, you stop it. So that part is still to be written, and that's still a part too that I'm working on too with our local university.
Exactly. And I know that, you know, public schools and post-secondary institutions, just like you said, they are still at the drawing board trying to figure out what to do, whether it's extending class schedules. That's something that I've heard, where typically a student may have, for example, a class they've signed up for that meets Tuesdays and Wednesdays. They may have to meet in that, stretch those classes out. The faculty members, so that they won't have such large class loads at one time. And so you find that, you know, faculty will actually be teaching more during the week, because there again, the classes are going to be kind of diced and sliced up a little bit, so that there's not as many students. But you know, it's still something that I think is ambitious. And to see the blueprint for it, it's going to be really interesting to see how, even beyond the classroom, how students actually handle the you know, the policies and procedures that the institutions are putting in place. But yeah, thank you, Susan Sasser, for joining us. She said, "Wait, I missed this. Will this be posted so I can hear it?" Absolutely. Just want to let you all know that, of course, every week our broadcast is posted on Facebook, and it stays on Facebook, but this is also available on YouTube. And so I'll be able to send out YouTube links to anyone, or show you where you can see it if you want to review the broadcast for the day, if you've missed some key things that Dr. McIver has shared with us today. And, you know, he went over a lot of the COVID-19 updates, what we know, quick talking points. Basically, Horry County is a very hot spot, not just temperature wise, but, you know, COVID-19 wise, with Carolina Forest being number 4 in the state. Socastee, what number was Socastee again?
Socastee was 7. Socastee was 7.
7.
Was 9, and Myrtle Beach was 14.
Yeah, this is in the state.
Right. And this is based out 534 zip codes in the state of South Carolina. So what they're doing is they're tracking this by zip codes. And now that more testing is being done, they're actually able to isolate what areas are really hot spots. And 4 out of the top 15 zip codes are in Horry County. Okay.
4 of the top 15. That's Carolina Forest, which is what zip code?
29579.
29579 Socastee.
29588.
29588 Conway.
29526.
29526, and then Myrtle Beach.
29577.
29577. Main corridor zip codes. I don't know that you pretty much driving up 501 and hitting all of these zip codes, basically.
Exactly.
Yeah, it's absolutely amazing. And then other key points before we get to our special guest. Just talking about the fact that nearly 1,000% of the new COVID cases are in the age group of 11 to 30 years old. Typically teenagers make up the highest percentage of that. And that would, I guess that age range was considered like 11 to 22 or something like that.
11 to 20, 966% increase in new cases. And 21 to 30, 414% increase in new cases. And this has been since April 4th.
Since April 4th. The other thing, and I want to go back to this map real quick, because I think this is a very interesting map. And of course, Dr. McIver, you can give your credits again to Jamie Arnold at WNBF. But looking at COVID as if it were a hurricane, as you can see, Conway Myrtle Beach is category 5.
Right. We can identify with hurricanes probably more so than COVID-19, as we've been dealing with hurricanes more. So when I talked to Jamie, this was what he did. And he basically took this, got this information from DHEC information. So it was extrapolated from there, but then he broke it down to the categories. And when I talked to him, I told him I thought it was real slick and I was going to use it.
Yeah, it is brilliant. I like that.
and he said, be my guest.
Awesome. Well, we have to thank him personally. And then of course, you brought up the fact that, hospital capacity, almost now over capacity. A lot of hospitals are at 100% capacity, getting there. And the bottom line is that, South Carolina is still testing at lower rates than other states. So the possibilities exist that obviously numbers are going to continue to climb. However, we have not yet gotten our hands around it the way that we should as a state. Right. So, that's what Dr. McIver shared in the beginning. And again, you can see all of or listen to all of the data and everything that he shared with us when you click the video for the rebroadcast a little bit later. So Dr. Mack, do you have anything else you want to share before we go into our special guest?
No, it's just, just still please protect yourself. The same thing, mask, social distancing, hand washing. Probably the most sobering stat to me, two stats, is that now we're hitting over 50,000 cases a day. Mm-hmm. Fauci said he wouldn't be surprised if we hit over 100,000 eventually a day. I'm not sure about that, but 50,000+ a day is a significantly higher amount than when we were doing 17, 20, 25,000 a day. Mm-hmm. So again, the other stat that's probably just around here locally is that hospitalizations in June compared to May to June went up 466% in the hospitalizations due to COVID-19. 466% in June. Wow. So it's real. And again, I can't express enough. I mean, we've been doing this for over 3 months now. Mm-hmm. And
every Friday.
Right. And it's the same precautions are still the same now as they were before. What's changing is the data. Again, we're the variable, the virus is the constant. And so we do our part to try and help reduce this virus. Because, heck, we're in July now. Yeah. In about 3 months, we're going to be in the cold and flu and pneumonia season. We haven't gotten out of phase 1 yet. We have not gotten out of phase 1. We're still in phase 1. And so at the rate we're going, it's going to significantly impact schools, athletics, jobs. It's just going to impact everything if we don't do our part to make this better and try to reduce the numbers. Mm-hmm. And again, I was telling somebody this, and then I'll be quiet. The same backlash that we're having now from masks was the same backlash that the medical community had when it came down to wearing seatbelts. Mm-hmm. Both of these save lives. Masks save lives, seatbelts save lives. And there was a lot of pushback against people being made to wear seatbelts. A lot of pushback is happening here. But again, the numbers are staggering. This is certainly not the flu. This is not the seasonal flu. We said that early. I said that early. This is not the seasonal flu. This is different. And other issues we'll talk about maybe next week is that the virus is changing. The strains are mutating. Mm-hmm. I think in Chicago, I was reading Chicago, they isolated like 8 to 10 different strands of the flu. Mm-hmm. So it's actually 8 to 10 different strands of COVID-19.
Mm-hmm.
So these viruses are genetically mutating. Part of the reason is because, I think the virus has been around in the United States longer than we once thought. But number two, it's just that people just aren't doing what they're supposed to do, and the virus is mutating because it's going from person to person.
Mm-hmm. Absolutely. Right. Well, Dr. Mack, I know you're going to stick around and talk with, help me with this conversation with our special guest, and certainly do appreciate all of our viewers tuning in today. Thank you so much, Monique Jones Burgess. 29588. Be strong, 29588. Yes, and I know she's definitely safe wearing her mask and doing what she's supposed to be doing. Sonia Street Ford, thank you so much. Terry Dow McLean, always supportive. Thank you. She says we were told that a heavy strand of flu was going around right now. Oh my goodness. Dr. Meg, you know anything about that? Not yet. Okay. And then, of course, Jolene Hatcher, thank you for tuning in. JD Spain Sr., we really appreciate it. And Amanda Butler. If you have any questions or comments that you would like to post for the doc, and we'll get back around to it. Typically, we try to circle back around. We really would love to hear your questions and comments. If we can't handle it this show, we definitely will do our research and address some of these things next time. But anyway, we're going to take a really quick commercial break, and then we will be right back with our very special guest. So stay tuned.
Your child deserves the best in life. Grow through learning and positive moments. Caring through love, nurturing, and support. Security in a clean, safe environment. Your child deserves your neighborhood child care and development center. 1100 Creel Street, Conway, South Carolina. ABC certified and USAID approved. Call 843-248-0560 or 843-248-3584 for enrollment information.
Your neighborhood child care and development center is open 6 a.m. to 6 p.m. Monday through Friday, enrolling children ages 6 weeks to 12 years old, serving Conway and all surrounding communities, offering after-school care with a professional, ethnically diverse staff. Your neighborhood child care and development center. Call today. All right, and we're back. And thank you again for sticking with us during our commercial break. We certainly do appreciate it. And we have with us today Denise Chatman, one of Georgetown's finest, absolute finest, of Optimism Preventive Services, and Dennzon Winley. Thank you guys so much for joining us today. How are y'all? You're on mute, Denise.
I'm well. Thank you for having us.
All right. Yeah, you're just muted, Denise. Unmute your mic. There you go.
There you go.
Yeah, you're good now. Mm-hmm.
Okay.
How are you, sister?
I'm great. I am great.
All right.
Great.
Yes, we appreciate you being on today. And let me tell you how this came about. So Denise posted something about a virtual trip around the world. That's kind of what I interpreted it to be. And I thought it was pretty intriguing and very fascinating that, in this time when we have to be extremely creative and try to figure out how to still deliver great programming from our organizations, that Optimism Preventive Services actually came up with a virtual, kind of like a study abroad or, trip abroad for teens. And it's called Beyond Georgetown. And so wanted to bring Denise and Dennzon on to talk about this 2-day conference, give us the information, what's to be expected. And I think you guys will be excited about the opportunities. Matter of fact, I wish I was a teen, I'd sign up for it. But Denise, tell us a little bit about what's going on with the study abroad.
Well, first let me let you know that you can join us because
I can join?
It's for ages 14 and up. So
you
can.
Okay.
But basically, I have a very young board of directors, and they are so sharp, so smart. So I was just sharing with one of my volunteers and board of directors now, Dennzon, that I wanted to do something different for the kids in Georgetown, but I wanted to, because even going through this pandemic, we still need to make sure that we keep these kids engaged and keep them involved. Mm-hmm. And so we were doing some virtual stuff, and we weren't able to do our regular summer leadership camp. And so I was talking to Dennzon. I basically told him what I wanted and what I wanted to do, and he took it to the rest of the group, and they came back with this proposal for me, made a few changes, and it just went from there.
Okay. So Dennzon, I had a chance to speak with you we were actually kind of emailing each other back and forth, and you are a mentor. We kind of established that you're a motivational speaker, and you're am I saying it right? You're a francophile. Is that correct?
Yes. Yes.
Yes. And so explain to everyone what it means to be a francophile.
So essentially, I'm someone who loves everything about French culture, French language, French society.
Okay.
I tend to tell people that I fell in love with the country in high school. So, we had the foreign language requirements. So I chose French. And since 2009, I haven't let it go.
Okay. Well, ça va.
Et ça va. Merci d'être invité.
Well, ça va bien.
Nickel.
Okay. So, and there was someone who actually saw the flyer and wanted to know a little bit more about you. I said, I'll have to hook y'all up a little bit later. Right now, we're trying to learn a little bit about the virtual conference. So, Denise, first, let's start with Optimism Preventive Services. Tell us a little bit about what you've been doing and how long you've been doing it. The teens, I've seen your programs, I've been a part of your programs. I think you're doing a phenomenal job in Georgetown with these mentoring. So tell everybody a little bit about what you're doing, and you've already told us how this came to be, but I do want everyone to know more about you as well.
Sure, and actually we just celebrated our 10th year as a nonprofit. So Optimism is a nonprofit organization, and our mission is simply to improve the lives of young folks through our education, mentoring, prevention, and leadership programs. And with that being said, some of the programs, and you've been involved, I think you came to us maybe about 3 years ago, and you were just so funny because all of these kids were all over the place. So you do know that one of our prevention program that we focus on during the month of October is our anti-bullying program. So we have that program, and that has grown, that March has grown from 60 participants to last year to well over 800 youth.
Wow.
And so we just don't stop there in the month of October. Bullying is all year around. Even as we go through this pandemic, we still have to focus on bullying and in ways to make sure that kids are protected. And then we have our teen pregnancy program, and you've been involved in that also. We also have what we call our annual teen dating violence program that we address every February. We have our leadership programs. We have peer mentoring programs. And we have, let's see what else we have. Peer mentoring programs. We have community service. That's very important. All of the teens that's involved in Optimism is required to do at least 100 hours of community service. Now, COVID is making it a little impossible for us, but nevertheless, we are still pressing forward and trying to, because we believe that kids need to know how to give back. We are so they're so involved in working, and work is important. But as they grow and get into adulthood, they need to know the importance of giving back to their community. So service is very, very important to me. So those are just some of the things that we have been doing for the last 10 years and some of the things that we are continuing to do. And that's why this virtual conference is so important, that we keep these kids engaged and involved and trying to make changes and instilling in them that they are the change. If they are to be changes, it's going to come through them, through the young folks.
Absolutely. So, Dennzon, tell us what your role has been. I know she said that you volunteered, and when you guys collaborated on this idea, what was the one thing that you wanted to make sure the teens were able to gain from this experience?
We're just really hoping to impress upon them that there does exist a bigger world outside of Georgetown County, outside of South Carolina, outside of the United States. Because even though the United States is a massive country, we're still within our bubble. So through all my extensive traveling throughout the world, I'm wanting to impress upon the teenage and any other participant that we have to prepare ourselves to assume our role as a global citizen. So with the conference, we're really just hoping to go into the various aspects of what it means to be a global citizen, cultural sensibility, and all that good stuff, the opportunities that really exist abroad.
Okay, all right. So tell us a little bit about the experience. What will participants be involved in?
So I believe each day on the 17th and the 18th, it will begin at 10 a.m. and conclude somewhere around 1 p.m. So on the first day, our main headline is Clarice Pope, Miss Clarice Pope. She is a United States diplomat in Jamaica currently. And so that's the headline where she will come to discuss American foreign policy, what it means to be a diplomat. Because when I was a child, I had no clue what a diplomat was. And everything that the Foreign Service has. Also, throughout the day, we will hold panels. There will be something called a Return Peace Corps volunteer panel. The United States Peace Corps is a federal organization that sends Americans abroad to we're almost like cultural ambassadors, but we're also expected to learn about the cultures in which we live in. And so it will be myself on that panel with some of my comrades from my cohort from 2017, 2019. We will discuss what we learned in Sierra Leone, West Africa. Also throughout the day, we will have music selections, the various styles of music from zouk, from the French Antilles to South Korean pop.
Wow.
And then on the second day, we have Dr. Paula Trekman. She's from MUSC. She's a virologist, and so she will be there to explain the nature of COVID-19, how these things morph into global pandemics. And also on the second day, we have, music components. We have a brother coming to speak on his experience from living in Abu Dhabi, his travels throughout the Middle East, why that region is the history behind that region, why it's so important. We have a lot of good things for both days. I think it's going to be very informative.
And so, and you've got yourself tagged as DM, so I'm gonna call you DM. So, so DM, you mentioned Sierra Leone. You've traveled a little bit. Tell us a little bit about your travels.
Yes. So after I graduated from USC Go Cox in 2017, I joined the Peace Corps, and we were stationed in Sierra Leone. I will readily admit it was not the easiest time of my life, but I gained so many invaluable lessons on life, community, culture. And I also tend to joke. I tell people, out of all diseases or sicknesses, diarrhea is the lesser evil. we were stationed in a village. We're not sent to these countries to live in the capital, to live a luxurious life like a real expat. We're sent in villages to get in the nitty gritty of development, education, health, youth development. So yes, ma'am.
How old were you?
I was, oh goodness, I was 22, I believe. 22.
Wow. 22. That's quite an endeavor at 22. Most 22-year-olds are trying to figure out how not to go over their balances on their debit cards. And you're halfway, well, across the world, actually, trying to help develop a country. That's amazing.
Yes, it certainly was a life-changing experience. Again, I don't tend to glamorize my experience in the Peace Corps. I tell her how it is, but at the end of the day, it was certainly an experience. And then after Peace Corps, I came back for some time. And then last year, I went to teach in France, which is my dream. That was my first time going to France. And I will say French children are very well-mannered. I don't know what people tend to think about them, but if they wanted to know, I thoroughly enjoyed teaching them. But all of that came to a halt, once COVID erupted. France, Italy were hotspots, and we were actually confined for 2 months in the house. And when we wanted to leave, we had to show the police something called attestation. It's like a piece of paper that's justifying your movements. And so, coming back here, hearing the doctor's analysis of COVID, I'm just like, Americans are really underestimating what's going on.
Dr. Mac, yeah.
So but yes, in France, France was also just a great experience.
Yeah. Pierre, I'm sorry.
I was going to ask, I think, Dennzon, aren't you going to teach a little French during the conference, just a little?
Yes. Just the introduction, because I know here in Georgetown High, they got rid of the French program. I don't know what it is throughout the other high schools in Georgetown County, but I know Georgetown High for sure. But yes, that is definitely a thing we're hoping to do.
Okay. All right. That's pretty impressive. Pierre Johnson joins us today. He wants to know if that's a Liberian flag, and did you travel there as well?
I'm so happy someone recognized it because I had my broadcast last night thinking it was one of the original American flags. And I was like, no, that is the Liberian flag. And I did travel to Monrovia for a week. And I spent 6 hours. Well, from my village in Sierra Leone to Monrovia, it's only about 200 miles. But I spent 6-7 hours on the dirt road to get to Monrovia. But once we got there, and it was during the rainy season. But once we got there, it was a good time because Liberians still have this African American influence on them because a lot of former slaves from the Americas, the United States was recolonized in Liberia and former Monrovia. But yes, that was a good experience.
Okay, all right. And Pierre says that he's currently a high school French teacher. He was in Senegal last summer. He's trying to connect to see whether or not you guys were there together or whatever.
We will
Pierre,
make that happen.
There you go. So thank you, Pierre, for watching today. Really do appreciate it. So how can we all get signed up for this experience, especially the teens? How can they get signed up?
They can register, and we're really glad you asked that question. But they can register at opsinc.org. If they just go there in the registration, we made it as simple as possible, didn't we, Dennzon?
Yes, we did.
As simple as possible. And we are really encouraging folks to get their youth groups involved. We really need folks to register. These young folks have put a lot of work into this virtual conference, and we need people to please get on board and let's register and make this happen.
And I think, Ms. Chatman, it's important that we reiterate that this is for the free 99. It is, I think a lot of people tend to look at it and think, oh, it's a conference, so maybe I have to pay. No. It's free. Just sign up with your email address, your age, your name, and there we go.
You get to travel abroad for how much? Free
99.
Free 99.
Yes, free 99. And the conference dates are July 17th and 18th, right? Okay. All right. Awesome. I'll make sure I post that up here. I'm excited. I'm going to tell some young people about it and see if we can get some folks signed up. And, because I think this will be an awesome experience. And if nothing else, it'll be intriguing enough that hopefully they'll want to learn more. And then possibly, once things in the world have kind of settled down a bit and we can move a little bit more freely. Maybe Optimism can work towards, hosting a travel abroad trip. I think that would be awesome as well.
We've talked about that, didn't we, Dennzon? We've talked about that. Yeah.
Putting it in the atmosphere.
Yeah.
Putting it in the atmosphere. So is there anything else you'd like for us to know about this conference or even about Optimism Preventive Services? How can young people in Georgetown County get involved? I keep telling Denise that she has the blueprint for something phenomenal. You have to see it to really understand what an impact her organization has on the youth. I've seen a lot of youth mentoring programs and engagement across Horry County, but I've never really quite seen anything like this. And I'm going to give her credit where credit is due, because it is phenomenal to see the number of young people she has engaged, even early morning sessions. They are there, especially that the conference that you had, the last conference I participated in. I mean, it was wall-to-wall teams. And it's so important that organizations that claim to work with teens really understand how to get them engaged and make it sustainable, because it's really important. I mean, we have some groups who, and Dr. Mack is a part of two very important groups in Horry County that actually do that. But there are other groups that, you definitely want to see the work as well. And so, how can young people get involved with your organization? What can they do?
Again, April, they can just visit us at opsinc.org, or they can just simply give us a call at 843-240-0411. And we really need these young folks to come on board and participate in this organization. We have opportunities where they can participate on national level. And you've had a young cousin. We have several national affiliates that are looking for young folks. We've had, I think, about maybe 3-4 kids from Georgetown County that has served on the National Youth Advisory Board. And for some reason, those numbers now are decreasing. And so we need parents. We understand that things are changing, but we really need these parents to encourage these kids to get on board. Even if, as we have our virtual meetings, we just don't have the parents there encouraging and pushing these kids, and they are missing out on so much. The opportunities are coming to me. I just need the kids so that I can share it with, so that we can get them to where they need to be. We are in the business of grooming and creating leaders. One of the things that Dennzon, our motto is, we have a picture of us that we're going to put up later that says, leaders create leaders. And that's what we are trying to do, but we cannot do it if the parent don't encourage the kids to participate.
Exactly.
Right quick, for the summer, basically, we have the virtual conference coming. We had our June community service project. We have our July community service project that we need kids. We'll be partnering with a local restaurant to provide meals for kids that are out of school and don't have anything to do during the summer. So we're going to be doing that. And we have our peer mentoring program that's coming up. And so we need students. We need some young folks to come and get this leadership training so that they can get on board and we can continue to make a difference in Georgetown County.
Absolutely. So I know you have an executive board, board of directors, and DM is a part of that, correct?
Right.
Yeah.
Okay. All right. I'm gonna see if I can show everyone. And it just, this is a really quick clip. But you have a board that is comprised of a lot of young people, and that's important. That's really important that the young people that you're working with understand and see themselves on the board. So I know it's a little hard for us to see that image, but can you tell us a little bit about your board?
Well, we have Jericho. As a matter of fact, all of these young folks that are part of the board, I think, except for one, they came through Optimism. So they came through, they saw the need, and they came back, and they're giving back. And I tell you, this is the best time of my life I've ever had in Optimism, because basically all I'm doing now is signing off. They have taken over, and they bring it to me, and I just sign off, and it feels so good. But we have Jerica Knox, who's a PH. I think she's working on her PH. She's the board chair. And we have Tanisha German. She's with Design and Program Development. We have Alexa Franklin. She's a teacher at, I think, Pleasant Hill Elementary. She's our secretary. Camelia Armstrong, she's our treasurer. And Shanice Joyner. She came through us through one of the other board members, and Dennzon. So they all have worked with Optimism for like 5, 6, 7 years, and they're just coming back to give back, and they're going to be the one that's going to take this organization to the next level and keep it going.
Awesome. Well, Denise, congratulations on all of your accomplishments with the young people. I can't stress enough how much I feel about your organization and what you've been doing in Georgetown County, and I keep telling you, you need to bring it to Horry County somehow. Some way, bring it to Horry County, and introduce it to our teens in this area. I think it's wonderful. Dennzon, thank you so much. We really do appreciate your work, and also understand that you're trying to go to grad school.
Yes, Austin for public policy. That's up in the air.
Okay, all right. Well, we'll see. And but if so, good luck, and keep doing what you're doing as well, because of course when you are exposed to new cultures and you bring it back, then you're exposing other people to those cultures, and you're inspiring someone to do some of the same things that you've done, and that's really what it's all about. So thank you so much. And Denise, do you have anything else you want to say regarding the 2-day conference? You want to give them the information one more time before we leave for today?
Sure. Thank you, April. We just want to really encourage parents. Parents, please get your kids involved. This is an opportunity like none other. Go ahead and register at opsinc.org. The registration process is very simple. Either give us a call at 0411, and we'll help you get your child registered. And just remember, we are inviting our neighboring counties also to get involved. So Horry and Waynesburg County, you are invited. Please come on board.
Okay. And if anyone wants to donate to your organization, can they do that through your website as well?
They can do that through the website. They can do it through PayPal, or they can Cash App us at Smart Teams.
All right. Okay. Well, we'll add that information to our comments thread so that, you know, anyone who's going back to look at the post will understand what they can do if they want to donate. But thank you both for joining us today. I really do appreciate it. Dr. Mack, we had a few people to join the thread since the COVID-19 updates. And I know it's too much for us to circle back around to everything, but, you know, got to give you the parting words since we're going into this holiday weekend. What do people need to know?
Well, you know, still be safe, be smart, be considerate of your neighbors. Remember, when you wear a mask, you're actually protecting the person that you come in contact with. So if you're not wearing a mask, you're not being considerate and respectful of the people that you're coming in contact with. You know, we'll see what the numbers look like next week. We'll see what the numbers look like in the coming weeks. I am an eternal optimist by nature, but I am a realist and a factual, scientific person as well. So unfortunately, there may be some numbers that we may not really like hearing in the weeks to come, but please, people, do your part. You know, this is not an old person's condition with COVID-19 complications.
Please make that clear.
I've got a person right now that's in his late 30s in the hospital that's been on a ventilator for over a week now. And so, you know, it's an issue. Please be careful, be mindful, and protect yourself, your community, your environment, and your healthcare workers.
Absolutely. All right. Well, everyone, thank you for joining us today. We really do appreciate it. And thank you to Keith Skinner, your neighborhood child care and development center. We really do appreciate it. Wonderful commercial. Thank you, Alexia Mills, for the wonderful voiceover. That was her voice. She and her mom are regular viewers as well of our COVID-19 updates. We really do appreciate it, all the way from Charlotte, North Carolina. And we just want to say be safe, and we'll see you next week, God willing. Right, Dr. Mack?
Yes, yes.
Absolutely. All right. Thank you so much.
Enjoy.
I enjoyed you. Thank you so much.
Bye, everyone.
Bye-bye.